More and more children are being diagnosed with autism thanks to early evaluations. And in today's MedWatch, we'll be telling you why it's so important to take your child to one and what it can do for your family. According to Autism Speaks, in the U.S., every 1 child per 30 children live with autism. About 4 in every 100 boys and 1 per 100 girls are being diagnosed every year. But what is autism? Well, there's not a definite answer. In fact, every case can be entirely different. Autism is a developmental disorder that impacts a person's ability to communicate and socialize, and there's a wide spectrum that can go from high functioning to low functioning. Common signs include difficulty with communication, difficulty with social interactions, obsessive interests, and repetitive behaviors. But all because your child is experiencing these issues does not always mean they're autistic. The only way to know for sure is by taking an evaluation. Why is it so important for people to come and get that initial diagnosis?
Early diagnosis is key so that you can start with intervention.
Dr. Ford is the only board-certified developmental behavioral pediatrician in Lawton, Oklahoma, who can provide evaluations for children who could be on the autism spectrum, which is a much-needed service in this area and now available at Lawton Community Health Center.
First of all, if a child is having speech delay, they need a speech therapy evaluation and a hearing evaluation. If they have fine motor delay, they need an eye test, because if you're not seeing well, then that's going to be delayed. The Comanche Health Department has early intervention. They can call the Comanche Health Department, and a parent can call or a physician can call in before that. You do not need a diagnosis to receiving early intervention.
Parents are highly encouraged to seek a formal diagnosis following early intervention. But sometimes parents may feel scared or even sometimes in denial. But the thing is, you are never alone in this journey.
Do not be so hard on yourself, because this is something brand new that you may just be discovering or trying to figure out what's going on. And as a parent, of course, you love your children and you want the best for them. So know that there is help out there and there are other people that are going through it. And so just don't be so hard on yourself. That's something I had to learn.
Nicole is a mother to 10-year-old twin boys, and they were born prematurely at 33 weeks. She and her husband were able to finally bring their babies home right before Christmas. And like any mother, Nicole was watching her little ones' every move.
So, of course, you know, you're sleep deprived, you've got these 2 little ones that you're like, what do I do now? And you're just doing the best you can. And so when they start to grow and develop, and you have 2 of them, I'm noticing there's a difference, there's a change. Probably like 12 months, I noticed that Tanner was a little bit withdrawn, wasn't answering or responding to us when we'd call his name. And so there were some things that I noticed that Taylor was doing that Tanner was no longer doing. So that kind of cued me in to say, what's going on?
Thanks to her question, she immediately turned to her friends and local resources like Sooner Start that were available at the time.
With Sooner Start, we got therapy in the home, which helped. And it also helped me to think that, okay, I'm gonna be okay, because there's a lot to navigate. It's scary. You feel, what can I do? What I do wrong? You know, you start to blame yourself, and you start to get depressed. But don't do that, because it's a lot to navigate through. And there are other moms and dads out there, and I've gotten connected with a lot of them that are going through similar situations.
Nicole and Dr. Ford both agreed that the earlier you take your child in for an evaluation, the better you can help your child get the right resources they need to develop and thrive. For those looking to get an evaluation from Dr. Ford, she says your child's pediatrician or provider can get them a referral to schedule an appointment. Currently, she is accepting toddlers and preschoolers. And for parents with children who may have already had a diagnosis, there are support groups for parents to lean on one another. And remember,
there's nothing to fix with your child, but it's something to help be the best version that they can be with the resources available.
For MedWatch 7, I'm Alexis Young.